I was working. It was actually a beautiful day out. It was gorgeous.
September 15th, 2016 is the day Julie George's life changed forever. The day her son Dylan Walling took a motorcycle ride south of Eau Claire, Wisconsin. The day she received the phone call every parent dreads.
And it was the police chief for Trempealeau County telling me that my son had been in an accident and it wasn't looking good. He was speeding and he was passing a few cars and he was going to pass the manure spreader and then realized that the manure spreader was going to take a left and he got back into the right lane and didn't have time to stop. So he hit the manure spreader full speed.
The 21-year-old, wearing a full face mask and helmet, hit the manure spreader at 80 miles per hour.
We're going to be receiving a young man who was involved in a motorcycle crash, severely injured, agonal, essentially near dead.
Dylan was airlifted by Mayo 1 helicopter to Mayo Clinic Health System in Eau Claire, the only verified Level 2 trauma center in western Wisconsin. With only 5 minutes to prepare for Dylan's arrival, trauma surgeon Dr. David Ciresi and more than a dozen members of his team raced into action.
And what we always like to say is like NASCAR. So when you watch the NASCAR pit crews jump over the wall, you got the right tire guy, you got the gas guy, left tire guy. Very similar with trauma response. Everybody has their role and their job as to what they're supposed to be doing.
We got to the hospital and I said, I'm here for Dylan Walling. And they were waiting for us.
So I remember just even to this day I can remember when they brought Dylan over and we transferred him over, it was a very short scene flight. They didn't have, he was so shocky that they were worried about putting the breathing tube in. They started to prepare to do that, but they were in essentially scoop and run mode. So they were just trying to step on the gas to get him here. So he was not intubated, very pale, it was the color of my coat, ashen with this beard, and having done trauma care for a long time, 19 years here, when you see a patient who's imminent for death, and that's what he looked like. He was trying to die in front of us.
After a rapid evaluation, doctors determined Dylan had devastating, life-threatening injuries to his internal organs, numerous broken bones in his arm, leg, and foot, along with a head injury.
He had an 88% chance of dying as the nature of his injuries.
Within 14 minutes of Mayo 1 landing, Dylan was in an operating room.
They had so many different surgeons working on him because he had internal injuries, he had broken bones, he had all kinds of stuff going on.
I opened his abdomen up and 4,000 cc's of blood poured out. Now his entire circulating volume of his entire body was about probably 7,000. So he essentially had exsanguinated into his abdomen and was bleeding from his liver. So his liver was cracked in two.
Dylan's first round of life-saving procedures, which included nearly 35 units of blood and plasma, lasted 8 hours. After an agonizing wait, Julie saw her son for the first time in the critical care unit.
He wasn't moving. He couldn't breathe on his own. He was just laying there. I prayed. I prayed for my son's life.
The next day, Dylan faced another 8 hours of additional surgeries and additional complications. He was facing the very real possibility of having his leg amputated. And then came the brain swelling.
Much like when you bruise your knee, when you hurt it, boy, it hurt a lot. And when you check a couple days later, you'll see that blood, and it'll look that way. Brain's the same way.
A monitor was placed in Dylan's brain to check the pressure.
There are tiny little areas where the nerves are essentially sheared off inside. So there's not critical bleeding that you can go in and suck the blood out, but it's more of a marker of the degree of force. You know, he was traveling at, I think, around 80 miles an hour. He was helmeted, and what I always tell patients is it's not the 80 miles an hour that's the problem, it's the short stop is the problem. And so he took severe blunt force trauma down the entire right side of his body, including his head.
For a week, Dylan remained in a coma as his life hung in the balance. Julie and her family were confronted with making some hard choices.
So about day 5, the pressure monitor was out, and he really wasn't waking up like we wanted, and he was critically injured. And so I've been talking with Julie and the rest of the family. I said, we're gonna probably wait another 48 hours to see what he can do. But we don't want to keep him alive if he's gonna be like this. What are your wishes? What would Dylan want?
We had to start thinking about how Dylan would want to live.
Pastors from Julie's church came to the hospital and asked if they could hold a special prayer service for Dylan. She agreed.
It was a Wednesday night, and the next day was Thursday, and Dylan woke up.
One of the questions, the commands that we'll do is, like we say, give him thumbs up. So that tells me as a surgeon that he hears the command, he can follow that and do that. It's an active motion. And that was just so exciting for me. I was like, oh, he's in there.
And it was that day too that he woke up that we were gonna take him off life support. Yeah, it's pretty incredible.
His first words, though faint because of a tracheotomy, "Hi, Mom."
He didn't sound like himself actually for a long time, but it was like I knew it was it's Dylan. He's able to speak again. Because I didn't hear his voice for such a long time. It was wonderful to it was fantastic.
Dr. Ciresi says if a level 2 trauma center had not been available for Dylan's immediate care, his outcome would have been very different.
Well, not all hospitals are the same. And so this is why, the American College of Surgeons verifies trauma centers. There's very few of them in the state of Wisconsin. Having that ability to provide for a community this size is unusual. If we don't do it, like I said before, people will die, no question about it. Do we pass the grade or not? We passed the grade. Other hospitals have not done that. So they're not a verified trauma center, and that's the big difference, is that when you have that designation, it means something.
Over 40 Mayo Clinic Health System physicians from more than a dozen departments assisted in Dylan's care.
I'm still astonished at everything that was able to be done, the amazing doctors that they have on hand right here in Eau Claire. It's absolutely amazing. It's a blessing. I don't think people realize what a great gift we have in this facility.
During the course of his hospital stay, Dylan underwent another type of physical transformation. Because of a tracheotomy and the monitor in his head, he had to have his beloved beard cut and his hair trimmed. You could say he resembled a familiar face. This one.
So we would joke about when we were in the clinic, back and forth, because how I look and how he looks and that kind of thing. And he's like, well, I think I'm going to have the beard back, and when do you think that that's going to be okay? And I said, oh yeah, go for it. When he was better. So that was good to be able to kind of bond with him on that.
On November 11th, less than 2 months after his accident, Julie took her wheelchair-bound son home.
You're letting me take this baby home by myself.
Dylan has no memories from the day of his accident. His back to epic proportions beard hides his trach scar, but there are some visible reminders.
But the ones on my arms, I got this one here, and I got one on this side because they put plates in there. But I look at them as, I don't know, it's like, probably would have been nice if I would have slowed down.
There's no slowing down Dylan today. While he still experiences some minimal short-term memory loss, he's working hard to gain his strength back, working out 3 to 4 times a week with his mom at a local gym.
I'd probably not be walking yet if it wasn't for my mom's help, because she did a lot once we came home with the wound cares and stuff. And then also brings me to the gym all the time, so even though I don't like going to the gym, I go with her anyways and try to get muscle back and get my cardio up.
Nobody likes to exercise or work out, and we're no different. So we're like going and doing this and like hating it, but I love it at the same time because we're able to do this. So we're able to go and, be gross and sweaty together. And I mean, I'm grateful that we're doing this. So I never thought that we would see this day. I mean, we didn't even know if he was going to walk again. Whenever we see each other in passing, we're always like waving at each other. It's kind of dorky, but yeah. So once in a while he'll come by and he'll like see how much weight I got going on there, because at first when he was working out I was stronger than he was, but now he's like definitely stronger than I am again. So he's like, I can lift more than that, or he'll say something smart. Yeah, he'll be like, is that all you can do? I've gotten that once or twice. Yeah, there's a little bit of that going on.
He'll fire off jokes. People that are head injured don't do that, and he's able to do that. So yeah, it's very remarkable. God works through mysterious ways, and sometimes through my hands, sometimes through other ways as well. So it was remarkable on how quickly he really came to it, and even more remarkable in my mind of when you look at him now, how functional he is. He's very 100%. People ask, well, why do you do your job the way you do it? I said, what's a better job on the planet? You get to operate on people and you save their lives on a daily basis. And I'm not just talking about with Dylan type patients, trauma patients, but cancer patients and whatnot. And they will simply say, thank you for saving my life. That's what I call the get out of bed factor. You can't beat that. He's got his future back. He's got a second chance on life.
Dylan is well on the road to complete independence and back in the driver's seat.
He's definitely a miracle because he was saved, and his life was saved by some pretty serious physicians and healthcare staff at Mayo. They did everything that they possibly could do to save him. We're all given gifts in life, and the biggest gift that I was given to was that Dylan was airlifted here to Mayo, and that there's such an amazing trauma team there, and they saved him. They really did. I am one grateful mama.